Hi everyone, I am very much surprised and elevated in mind because you liked my previous video on the concentration of the mind in Bengali. Now today the session is on the septation of the atria. Previously I have done the first video of the development of the heart. Now you will see, I will show you in the previous video that there are the formation of the heart tube. You see the lower one is known as the sinus venosus, the upper one is known as the primitive atrium, this is the primitive ventricle, this shiny color is the bulbus cordis, and this is the truncus arteriosus, which divides into 6 pair of aortic arches. Now I am showing you that this thing, it is flat one, but in the body this is not flat, it has got a volume. So now this thing I have made in the 3-dimensional form. This is the model which I have collected from our waste things from our house, and it is very difficult to do model of this development of the heart. Now you see this lower part is represent the sinus venosus, 3-dimensional, and you will see this upper part, you look this one, this is the primitive atria. This red color represents the primitive ventricle, and you will see then this magenta color, it represents the bulbar cordis, and then this is the truncus arteriosus, and from the truncus arteriosus you see there are the pair of aortic arches which I have done on one side. So this is the 3-dimensional model of this heart. Now I came to a chamber of the heart which is known as the atrium. You see, I make this model transparent so that you can notice what thing goes inside the primitive atrium. Now the primitive atrium, actually it is a monoatria. There is the development of a septum from the dorsal aspect, and this septum you will see, this is arch-like, and this arch-like, like this is the arch-like fashion. So there is development of the septum, and this septum is known as septum primum. So you will see this black color septum, it descends from the dorsal aspect of the atrium, and you see this has got a crescentic margin and it goes downwards and downwards. Now in the atrioventricular junction there is formation of, you see, this is the 2 endocardial cushion, and this endocardial cushion is known as the ventral and dorsal endocardial cushion. You see, this is the ventral and dorsal endocardial cushion. This endocardial cushion then grows gradually and ultimately they will fuse with each other. So there is formation of another septum which is known as the septum intermedium. So I will make this septum intermedium in this way. So this is the formation of the septum intermedium, and this divides the atrioventricular cavity into 2 halves. Only this region, that is the right half and the left half. Now what will happen? This septum primum descends and descends gradually, and what will happen ultimately, the descent is so much that it will actually fuses with the septum intermedium. So there is fusion of the septum primum with the septum intermedium. But what will happen if there is no blood flow into the left atrium. The right atrium, there is blood flow through the inferior vena cava and the superior vena cava. But how this atrium will develop? If there is no work, there is no development. So in order to develop this left atrium, what will happen? There is perforation in the region of the septum primum. And this perforation is known as the ostium secundum. So you will see there is formation of a perforation. How this perforation is formed? You will see here there is formation of this perforation, so that some portion, there is the portion remain which allows the blood to go into the left atrium. So there is the foramen. Now this foramen, you will see, this foramen is a simple foramen. Now simple foramen, what it will do? They will only transmit the blood from right side to the left side. But in order to make it more effective, this foramen must be valvular. So how this valvular foramen is formed? There is formation of the another septum. How this septum is formed? From the right side, there is development of the another septum. So you see, from the right side there is development of the another septum, and this ultimately it obscured this foramen. So this flap-like valve is known as the foramen ovale, and during the fetal life all the bloods go through the foramen ovale through the valvular action to the left atrium, so that left atrium will be developed. Now when there is the birth of the baby, you will see then there is abnormal stoppage of the cutting of the umbilical cord. So what will happen? The inferior vena cava does not carry the oxygenated blood, and first breath of the baby there is opening of the pulmonary vein carrying the oxygenated blood. At that time what will happen? This thin septum primum, it fuses again the septum secundum, and there is formation of fossa ovalis and the limbus fossa ovalis. This is the dissected specimen of the heart, and you see this is the crista terminalis which divides the posterior smooth part where the vena cava opens, and anterior rough part. This is developed from the primitive atrium, and smooth part is developed from the sinus venerum. And you will see this is the right atrium and this is the interior of the left atrium. So this is the interatrial septum. Now this interatrial septum, you will see this is the fossa ovalis, and that is formed by the septum primum, and this is the limbus fossa ovalis, that is formed by the septum secundum. Now this foramen is closed during the birth of the baby, but sometimes there may be small pin-like foramen, that is known as the probe patency of the foramen ovale. This is physiologically it is closed, but anatomically it is opened. But there may be a condition which is known as the atrial septal defect. In this defect there is a foramen persistent here. Now this foramen will gradually increase when there is increase in the size of the baby, and when there is the force of the blood increases. So one should go to the cardiological surgeon, cardiothoracic surgeon, to make this opening closed. So thank you everyone, and give me some remarks so that the video will be gradually better. And I will show you that I have written 3 books. One is the Anatomy at a Glance and Exam Oriented Text. This is translated in Chinese language and taken by the McGraw and Hill. The whole anatomy in 500-page book. That covers the must-know zone. Next, the dissection manual, cross-sectional anatomy and living anatomy. This is actually the cross-section is nowadays very common. You will see the CT scan, MRI, everything. That's why I have made this cross-section. And in our West Bengal, the cross-sectional anatomy is given in the examination. Now this is the 3rd book. This is the surgical anatomy, a student's manual. It has got the explain why, the surgical reason, and there is also the short note. The postgraduate short notes is also there. So again, thank you everyone for your patience.